As a student of the UW system preparing to return to school, we want you to know it's UW system and your campus's mission to keep everyone safe during this unprecedented time. Your health and safety are our top priority. This means that we all must take responsibility and actions to protect our fellow students, faculty, and staff from the spread of COVID-19. This video will provide you with basic information on what COVID-19 is, how it spreads, symptoms, what you can do to avoid the virus, what to do if you're sick, information about face coverings, and mental health and well-being resources. In order to keep each other healthy and safe, all students will be expected to comply with your campus policies, protocols, and guidelines. Watch for information provided by your campus. Coronavirus is an illness caused by a virus that can spread from person to person. Symptoms can range from mild or no symptoms to severe illness. People can also carry and transmit the virus without showing symptoms. COVID-19 is spread through respiratory droplets that are released when an infected person coughs, sneezes, or breathes. These droplets can remain in the air and on surfaces for an extended period of time. When people breathe in the droplets or touch surfaces that have been contaminated and then touch their mouth, face, or eyes, the virus can make them sick. Symptoms may appear 2 to 14 days after exposure to the virus. These are just some of the symptoms a person may have. Daily symptom monitoring is an effective way to detect the early onset of the virus so individuals can self-isolate, test, and reduce the risk of spreading the disease. You should self-monitor for symptoms each day. And if you have symptoms, contact your student health services for instructions on what to do. In some cases, there are emergency signs that require immediate medical attention. These include trouble breathing, persistent chest pain or pressure, new confusion, inability to wake up fully, or bluish lips or face. Please call 911 for emergency medical attention. There is currently no vaccine to protect against COVID-19. The best way to protect yourself is to avoid being exposed to the virus. Good hygiene and healthy habits help minimize the spread of COVID-19 and most other illnesses. Those include physical distancing, hand washing, minimizing contact, and wearing face coverings. Social distancing, also called physical distancing, is one of the best tools to avoid being exposed to the COVID-19 virus and slowing its spread. Since people can spread the virus before they know they're sick, it's important to maintain a safe distance from others when possible. It is recommended that you stay at least 6 feet, about 2 arm lengths away from other people at all times. Your campus will have specific guidelines for classroom settings and group gatherings. Washing your hands is another critical tool to prevent the spread of COVID-19. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, after blowing your nose, coughing, sneezing, or touching your face. Avoid touching your eyes, nose, and mouth with unwashed hands. Minimize touching non-personal items as much as possible. Instead of touching doors with your hands, consider using your shoulder or elbow to gently push your way through unlocked doors, or use a paper towel to turn doorknobs or push buttons. Appropriate use of face coverings is critical in minimizing risk to others near you because you can spread COVID-19 to others even if you do not feel sick. Cloth or disposable face coverings are not a substitute for social distancing. If you cannot provide your own personal face covering, talk with your campus contact. Also, consult with your student health services if you have a medical condition that prevents you from safely wearing a face covering. This graphic shows examples of how to properly wear a face covering. The key is to make sure the face covering fits snugly, without gaps, and covers your nose and chin as well as your mouth. Avoid touching your eyes, nose, or mouth when removing your mask. Wash your cloth mask daily. Immediately replace cloth mask coverings if they are damaged or visibly contaminated, and throw away disposable masks each day. Your mental and emotional well-being is important to us during these times. Don't hesitate to contact your campus student health services if you need this support. Thank you for taking these health and safety steps to prevent the spread of COVID-19. Make sure you follow your campus health and safety requirements. Contact your campus student health services if you have physical or mental wellness concerns. The health and safety steps you take will help ensure your health and the health of those around you.